exactly bipolar disorder?
Okay, first of all, let me know what is the purpose. Like, you have to. This is a project that you have
Yes.
taken.
So
Okay.
I'm actually studying MYP, and for MYP there's no exams. So what we actually have to show that how studying in MYP throughout the years have affected my learning process, and this is an effective way of showing how I actually go about it.
Okay.
Yeah.
What is a bipolar disorder? Okay, bipolar disorder is a type of mood disorder where there is a um, disparity of mood. I mean, the mood may swing from a low mood to a high or relatively higher mood in phases. So there has to be a period of largely depressed mood and a period of high mood, ecstatic mood, which is not explainable by the surroundings, environment, and the period of both of these may differ. So that's how we classify bipolar disorder. Yeah.
Okay. So according to the statistics or over the years, is there any kind of genetic components that are involved in this? Like, for suppose, if a mother has bipolar disorder,
there is genetic preponderance, but it's not very clear how it is, though we keep hearing, like, there are certain chromosomes, there are certain sites on the chromosomes wherein if at all a person is carrying, they are known to have genetic preponderance to get this kind of mood disorder, but it's not very clear yet. But then they say that if one parent is bipolar, then there is say 4% chance in the progeny to get similar disorder.
So I've done a bit of research before coming, and what I've got to know that there's bipolar 1 and bipolar 2. So what I want to know is what is the exact difference between bipolar 1 and bipolar 2 that they are classified as?
Bipolar 1 is a clear-cut demarcation of a depressive phase and an ecstatic phase. Okay, and bipolar 2 is a depressive phase and not so high mood, which you call it as hypomanic phase. Yeah.
Okay.
So there is a way to understand, a criteria to understand what is an ecstatic phase. So hypomania is not so ecstatic. I appreciate you want to know so much.
Now, do you mean euphoria by the hypermaniac stage, or do you just mean that a person is just hyper like that, just the mood swing?
Hypomania is a state of mind when one is when we are talking, we get emoted by situations, right?
Yeah.
We emote with situation, but hypomania, in spite of a neutral situation, a person feels a little higher than usual.
Okay. So what are the exact symptoms of bipolar disorder that any patient, or for example I can show something like that?
Exact symptoms.
Okay, first of all, is there any exact symptom?
There is the person may fall. There is a cycle that you have to see, that if there is a cycle that of a changing mood in phases, like sometimes for a period more than a fortnight, the person has to be depressed, and the person has been ecstatic in a very high mood, not being able to explain with the surroundings and not under the effect of any substance. That's when we categorize it. In this case, there is a criteria for depression as well as mania. We call it mania.
Okay.
Yeah.
So there is up and down after certain intervals.
Yes.
So nowadays, most of the high school students, or we can say that teenagers, go through such phases. So would it classify them as they have bipolar disorder in that way?
No, the period is very important. So depression has to be more than a fortnight. May be followed with a neutral period and then the manic phase.
Yeah.
Yeah. So
Manic phase means?
high phase.
That's a high phase.
High phase.
Okay.
How is it exactly diagnosed? Because for any other diseases? For example, if I have a fever, I have thermometer.
Yes. So we have a clinical on-table diagnosis with we have a criteria to label a person. So, for example, if one is going through depression, one has to see the past history, how it has been happening. Has it been like, has there been a phase of high mood as well in the past, and all? Has it been the effect of a substance? Depression, there is a criteria. There are 9 criterias. You can probably read up. It's like DSM-4 criteria. Even if you write Google it on DSM-4, low mood, crying spells, lack of sleep, lack of appetite, feeling less enthusiastic, all these, suicidal wishes, self-harm, and all of that, depressed phase. Hypomania would be like feeling too high about oneself, feeling about oneself out of capacity. As if, like, for example, if I have 10 rupees in my pocket, if I have a laborer, and I feel that, oh, I can make things happen, I know Narendra Modi, and things like that, things like feeling talking in a very pressured manner, feeling extremely irritable if the other person interrupts. So you'll find it on the net. DSM-4 criteria, if you type, you'll get all of these.
Okay. And what are the treatments given in Mumbai usually for this disease?
Bipolar disorder. Pharmacotherapy, medicine setters, and psychotherapy.
Okay, so for pharmacotherapy, what medicines, like, do you have any do you have obviously specific medicine, but
Yes.
what can be the possible side effects of that?
All these medications have side effects. They have to be monitored. They have to be told to the patient or else a relative that these may be the side effects, and monitor them.
What can be the possible side effects for
Weight
it?
gain, tremors, drowsiness, all
Okay.
of these.
Okay. So for how long is the course of medicine taken?
There is no thumb rule to it, but they say that once a person gets the disorder and has been documented a case of bipolar 1 disorder or bipolar 2, they have to take medications lifelong.
Okay. So I've actually searched on net, and what I got is there's something called electroconvulsive therapy, and is it actually still used to treat
Yes, very
this?
much. It is the.
So they electrocute this patient to.
No. They give general anesthesia, short-term general anesthesia, and they give a spark at the temporal areas of the brain, and that is known to help in crisis situations and special class of population, like in pregnancy and all, when you can't use and you should not use the medications. Ideally, that's when this is the line of treatment, and it is still used.
Okay. What are the major signs that someone could have developed a mania or hypomania over the course of years?
Making mistakes in daily chores, a reckless social life, substance abuse. These could be symptoms, some symptoms, but not necessarily every person who has these symptoms has bipolar. But yeah, these can not being able to be control of situations. These can be some symptoms which one can, just review and discuss with the mental health professional. Why is it happening?
Okay. So is there any possibility that stress and irregular sleep patterns can affect the illness?
Yes.
If so, how?
We advise generally if there is an altered sleep cycle, and it just adds to the stress, and thereby a relapse.
Okay.
So we advise not to engage in shift duties, or rather have a proper bedtime.
So do you actually give sleeping pills for this patient?
If required, yes,
Okay.
to maintain the bedtime, the regular bedtime, yes.
So what are the benefits and risks of taking antidepressant for bipolar depression?
Bipolar disorder, we generally don't prescribe antidepressants. We use mood stabilizers and antipsychotics. And what did you ask? The side effects.
Yeah, what are the benefits and risks of taking antidepressants? So what you've told that you don't use antidepressants for bipolar depression, right?
Yes.
Okay, so if mood stabilizers are used, like to what extent is it beneficial to the patient?
So if there are crests and troughs in mood, naturally the life becomes very reckless, right? So it just helps to maintain a constant mood, unaffected by the neurochemical imbalance. I mean, you take care of the neurochemical imbalance which is happening at the level of the brain, so that the mood doesn't have those highs and lows.
And is blood test required for this?
Blood tests and sense.
In terms of testing if the
We can do neurochemical study, serum serotonin, serum dopamine levels. We do require blood tests while the patient is on the treatment to assess the serum drug levels and all of that.
Okay.
Yes.
Okay. So how after the patient is on medicine or treatment, how do you exactly measure the progression?
There are scales. There are psychometric scales. One has to scale the disorder, so that the person also understands that where do I stand today, with the treatment and all of that.
Okay, so this treatment is actually
What is
over.
what is that psychometric scale?
Psychometric scales. There is CGI. There is Hamilton depression rating scale.
So with that-
HDRS. Yeah.
So basically, it's just the basis of scales that we
Psychometric testing and a holistic clinical analysis as well, and how the person is able to cope up with social life, professional life, and also,
measure. Okay.
yeah.
Yeah. So, what is the role of family members for the recovery of bipolar disorder? So as long as like simultaneously with medical treatments, what can the family possibly do for the recovery of the patient?
They have to be psychoeducated once. I mean, this is the disorder, accepting that this is a problem. What can happen? How is the prognosis? All of that. Besides that, how to react with the patient in terms of in times of crisis, and also how to take care of the compliance and all. You cannot be watchman all the time on the patient. So if the patient is elderly or something, you cannot be a watchman, but still in a subtle way to handle. Relatives feel that, oh, we have lost upon the patient and he's not able to take care of. So understanding that he still has that cognitive level to think but only in the crisis he loses it. So the intelligence is still there. Some people exercise control, that we will decide about the patient and what to do, what is right and what is wrong. So to understand that that is what psychoeducation helps, and family has a huge role. Family therapy is one aspect of the treatment.
Okay, so for psycho, like what you've told, that the family has to know what this disease is about. Is there any workshops done for that, or just you just talk to the doctor and the doctor explain what exactly is happening?
There are group therapies. People do conduct group therapies to psychoeducate the relatives, but I do it on a personal basis.
Oh, okay.
Basis.
Is there any kind of helpline for this illness in India or Mumbai? Because like for example, they have helpline for people who want to commit suicide. So is there any kind of helpline for this purpose as well?
Just to bipolar disorder, no, because but then these people do engage into self-harm and things like that. So there are groups available, group therapy available, wherein the patients as well as the relatives are they conduct sessions for them in a group, and I'm not aware of a specific helpline for bipolar disorder. There's none.
Okay. Is hospitalized necessary for this illness?
Yes, at times of crisis.
So, like, what kind of crisis exactly?
if a person is extremely violent, aggressive, like in a manic phase, if a person is engaging into self-harm in any way, like in manic or depressive phase, homicidal or suicidal, suicidal, or engages into excessive, shopping and extravagance and all of that, then also.
Okay. And just the last question. What is the percentage of people that actually recover? Like, what is the percentage? There has to be like you have recovered 3% or 80%, 70%. What is the percentage of the people can recover through the treatment?
It's a very broad question. Recovery, how do you define recovery is what is important, because they are known to have relapses in spite of everything being very ideal. Then they're known to have
Okay.
relapses. So
So
if you think that they are maintainable, they can work, and still they are aware that okay, these are the initial symptoms. There are patients who are like, I'm losing it, doctor. I'm racing with my thoughts, and they come walk in as well, with the relative or without the relative. So I would say that is a huge recovery. The percentage I wouldn't be able to say, because as I said that it's a very broad kind of a question, and how do you define recovery?
Okay. Yeah.
Yeah, very interesting subject. I have just got going through this question, is that what is the kind of awareness level right now is in the society on this particular disease or mental disorder, whatever it is? Very poor.
Very poor.
And if you are given a chance to raise the awareness level, okay, what according to you should have been done? Like AIDS, okay, we have come across a lot to raise the awareness level within the society.
Campaigns, ads.
What best could have been done to actually, because what I understand from this is that it is a silent sort of thing as of now, which people may not have also detected as a disorder.
Yes.
So is there anything that one can do to enhance the awareness level?
See, awareness programs and awareness campaigns should be done at community level, but addressing the issue at the grassroots level, like educating the parents. If a child is having, sometimes it's really ignored. Like if the child is irritable and sometimes having a disparity of mood, it's just ignored. Oh, it's just part and parcel of life. Awareness at different levels, I believe, for prevention, for it may be for at different levels. And the patient is already a case of bipolar disorder, then awareness to the relatives, and if at all there you see a preemptive symptoms of this kind of disorder or any psychiatric disorder for that matter, the parents need to be aware, because there's a huge denial that we see in a child guidance clinic, when the parents say no, how is it possible?
So in fact, as in parental guidance, we can raise the awareness level.
Parental guidance, relatives being aware of. Generally, bipolar disorder and schizophrenia, they make a bread and butter of the psychiatric clinic. But then initially, when the symptoms may be there, they're just feeling low and all. Sometimes they don't bother because gaadi chal rahi hai, you know.
Second and last question is that, say even bipolar disorder is detected at the very early stage of in a child maybe, is it that through additional caring as the child grows, it will completely be eliminated because of the caring and whatever is the suggestion or the treatment?
You can hugely prevent relapses, prevent the social withdrawal that they go through, prevent the repercussions of the disorder. If you treat
Early.
Yes, early onset psychosis. If you rather any early onset psychosis, you treat it as either heading towards schizophrenia or bipolar disorder, and you're very cautious about it, so yeah, you can reduce the repercussions of the disorder, which may be in the social life, professional. They usually suffer from social isolation, social problems. because of the disorder. They lose time, they lose their work, all of that.
Good. So I'm clear from my side. Whatever you have told, it's a very interesting session. Yeah.
So what I actually plan to do is make a website to make people aware of it, because I think in a modern age it's the best way of awareing people of what this is, what this disease is. And what I've researched is suicidal thoughts and also leading these actions can be a cause of bipolar disorder. So in that way it's important to make people aware that these are some kinds of things that you need to take care of.
Okay. Many thanks. We have taken